I do feel like I have like ample access to doctors, emergency departments, and specialists, which I'm dealing with too. So like I have never had a problem with him.
I feel, that I do, but it's the timing to get to some of these appointments. You know, periods of 4 to 5 months to see specialists, especially for, problems to be looked at, certain problems such as I've got carpal tunnel, and it's taken me 6 months to go and have tests done on my wrists.
Oh, wow.
Yeah, it's taken that long.
So like when I go to the emergency department, I've like had a good job of floating through the triage and all this and that. I've seen other people that were worse condition than I was because of the way they talked, the way they looked, or even smelled. They were treated different, and that's a fact. And I've seen that, and it bothers me.
They think that because I'm native that I drink, and I don't drink at all, and sort of like, and they stereotype me, and I don't like that. They tried to end one shot. There, she walked into the room and offered everybody in the room, and I asked, and she wouldn't give it to me. I said, well, why not? Asked everybody else, well, come, you're not asking me, right? She didn't say nothing, she just walked up the room.
They take the white people in first. That's how I see it, lads, there, because when I went there for my stroke thing and I had an appointment at 3, I was out of there at 4:30, and I was there before the other people.
Like I say, I've been here 15 years. These guys kept me alive for the last 8. Straight up, kept me alive. And I'm not an easy person to deal with. I always refer to them as a friend. He said, I'm your doctor. I said, yeah, I understand that. But I said, you treat me like a person. And that makes a difference. He's gone out of his way to give me his opinion when he shouldn't. He thinks he shouldn't anyways. But like that's what a lot of us want to hear. Like a lot of us want somebody to notice us and care for us. And not just open that fucking prescription book and this or that. Oh, you're sick, come back tomorrow, whatever. Like, he takes time and, like, I don't know if you're supposed to, but he dwells into your life and see what's causing a lot of the medical issues that are going on.
My doctor, he always listens to what I say. And he's very helpful that way. I asked to have my hand amputated. My specialist wouldn't listen to me, so I got my doctor to talk for me, and he did a good job.
My lady doctor, she's actually a very good listener. She questions you thoroughly, and I appreciate that in a doctor, but I just don't like going to see a doctor and being kind of sloughed off on, here, take this, and if that doesn't work, then come back, we'll try something else.
I went through a lot of turmoil, like trying to find the right concoction, because I started when it was just a big ball of liquids.
Sometimes, yes, my doctor, she's pretty stingy, especially when it comes to Tylenol 3s and stuff like that. Even though I've never, I hardly ever use them or ask for them. But when I, have to say to her, I really do need something for the pain now, especially because I am getting older. And a lot of the stuff that is out on the shelf just does not work.
I've tried them. I'll give anybody a chance. But like a lot of them, like, I don't believe in their mission statements, blah, blah, blah. Because the bottom line is, this is how I feel, if you're going to do it, you got to do it because you want to do it. It's got to come from the heart. I'm going there for answers. I'm going there for supports. I'm going there to find out, is there something that I'm not doing that could help me? And so, like, the bottom line, after years of doing 2 or 3 different programs, I just found out that you have to want to do it.
No, they try to make you do things their way, like, I don't know, AA for instance, they want you to pray to God and everything, and I don't pray to nobody's God, and they're quite adamant that I had to. I don't have to do nothing, I'll go home.
There's no way anybody should go hungry for any reason, straight up. If I wanted to, I gotta weigh 300 pounds. I could get up at 6 o'clock and I could start at the breakfast club down here and eat at 7. I could go to the Hope Mission at 8. I can go to Bissell at 10:30. I can go to the Bo McCauley, go to co-op at 11:30. I can go to the Marion at 12:30. Like, trust me, you can eat. And medical attention, it's there. Like, straight up. Like, for anybody to say that or even, profess that, it's bull.
Well, I was homeless for 6 months there, no place, living on the streets and that. And I couldn't get the right nutrition that I needed or whatever from nowhere. Okay. Then finally my doctor put me on some glycerina stuff for nutritional stuff. Now, I used to weigh 260 pounds and now I weigh 200.
No, my doctor always used to write me letters to have a room. I don't. If I don't put myself in there, no, my doctor always helps me.
I'm on age, so like I've been on medical for like 6 years, and I finally got on age about 3 years ago. So like, I don't have any problems like have my medication paid for because I have some serious expensive shit going on with me. Right? So no, I don't. And as long as there's some kind of support out there, like the majority of people on the street, the majority of them are on some kind of assistance. And there's an emergency line that you can call for emergency funding and stuff like that for medical. Because, this is Canada. This ain't the States. We are lucky, boy. Straight up.
Actually, I am having a problem with my feet, and Alberta Healthcare only pays half. I've got bunions on the sides of my feet, and Alberta Healthcare only pays half.
There's one cream that I use for my eczema. They wouldn't give it to me over there because it wasn't covered, and the doctor didn't. I think I gotta come back to the doctor and ask her to phone my big stone, my Korea big stone people for me to get that cream because that's the only one that's really good for me.
I think we need some more specialists, definitely, that are qualified to give proper diagnosis.
The front line's attitudes, the perception. Like I understand they have bad days too, just like we do. But the thing is, they're professionals, and they gotta reflect that back onto us.